It's wonderful to be here with all of you. Good morning and good afternoon, wherever you may be. Bienvenue à toutes et à tous. C'est un grand plaisir d'être ici avec vous aujourd'hui. I'm Elissa Strome. I am the Executive Director of the Pan-Canadian AI Strategy at CFAR, and I'll just ask my fellow panelists to come on screen and introduce themselves before we jump in. Aline, over to you first.
Hi everyone, good morning. My name is Aline Talhouk. Mon nom est Aline Talhouk. I am an assistant professor in the Department of Obstetrics and Gynecology at the University of British Columbia. I'm a statistician and machine learning scientist by training, but I work in developing predictive models in women's health and oncology. And as models have become larger and larger, necessitating more data, I became more interested in trying to access these data more broadly so that the whatever models we develop could generalize to broader populations.
Great. Thank you for that additional context, Aline. John, over to you to introduce yourself.
My name is John Langford. I've worked on machine learning, AI research, I guess, for a couple decades now. A lot of what I worked on is, I guess, centered around kind of interactive learning of various sorts. Of relevance to this, I've worked on kind of looking at differentially private sharing of data across in a federated setting. And doing that, you can see that if you can personalize on the ends, you can actually achieve a better privacy accuracy trade-off.
Great. We'll dig into that a little bit more, I think, in our discussion. Thanks, John, for the preview there. And Rui, over to you.
Hi, everyone. I'm Rui Duan. I'm a assistant professor in the Department of Biostatistics at Harvard University. My research mainly involves statistical and machine learning methods to integrate data from multiple institutions. And that would involve challenges, for example, how to protect individual level patient privacy using federated learning or distributed learning strategies. I also work on meta-analysis, which is another more straightforward way of leveraging data from multiple studies. But I also have focused on the data set shifts, data heterogeneity problems in a multi-institutional framework. So how you can study a particular population of interest while leveraging heterogeneous data from other places.
Great. I think we'll dig into that topic a little bit as well, too. So for me, I was really excited when Kim asked me to moderate this session because AI for health is something that has been a personal priority for me and a strategic priority for CFAR for several years, particularly thinking about our work in the context of the Pan-Canadian AI strategy. So in 2020, we led a national task force developing recommendations for policymakers on what needed to happen in Canada and what the opportunity was in Canada to be able to leverage the great strengths that we have in AI research and innovation, as well as in health and biomedical sciences research and innovation, and our wonderful healthcare system to be able to actually deliver better care for Canadians, better treatments, better outcomes, and improve efficiencies within our healthcare system. So the task force work was happening in 2020. In 2021, we actually named AI for Health as a strategic priority of the Pan-Canadian AI strategy and have been working with many partners across the country and across sectors to advance that work now over several years. And I would say that we've had a renewed interest in the last 6 months or so. We're working now with Health Canada as they think about their strategies to remove barriers to the deployment of AI within our healthcare systems. And federated learning is one of those topics that deserves special attention. So that's why this series is so important and this conversation is so fascinating to me personally. We also published a policy brief for policymakers on federated learning with Aline as one of the co-authors last fall. So really, really excited now to dig into with all of you, with our experts here who all have had hands-on direct experience in deploying federated learning approaches on the challenges of this approach. Obviously, it's great strengths. I think we have spent a lot of time thinking about and understanding the strengths, but actually making it happen in practices and the challenges and how to overcome those challenges, I think are really going to be the topic of today's discussion. So let's start by sharing some very specific examples and case studies, everybody's direct and hands-on experience. Aline, I'm going to start with you and ask you to share one example of your work using federated learning.
Yeah, so again, just going back to this idea of as models are becoming more complex with the use of machine learning and deep learning, these models need more data. And as this whole series has sort of showcased, data is never located in one, or not enough data is ever located in a single institution. So that data is often distributed across multiple institutions. And quickly, if you're developing a model that you want to validate or that you want to use data and generalize to a broader population, you need to access that data from the various institutions. And when we started doing that, so we have a project that's hoping to do exactly this. So we're developing a risk prediction model for the incidence of uterine cancer. So uterine cancer is the most common gynecologic cancer. And one of the things we want to do is see who is most likely to get that cancer so that we could direct them to targeted prevention interventions. And, when we went to try to get access to the data from the various, so there's this CanPath cohort, which is our population-based Canadian cohort that has collected data at baseline. And we wanted to see, well, can we use that data to predict who's going to get cancer over a period of time? And to do that, we need to link that baseline data to outcomes data. So we needed to link it to administrative data sets, cancer registries, medical records, essentially. So that's when, my first foray into the world of distributed data analysis, because now this data is at different provinces. I could kind of tell you a little bit about the story.
Sure.
So we went to do it. It's a process that's been going on since 2020. So it's been taking 4 years, and we still don't have access to all the data sets. And so in an ideal world, if all these data were federated, I would just request access from a single place, one data access request. The data would be available at the various institutions. It would be in an interoperable, saved in an interoperable manner. And so I could develop my code in one data set, say British Columbia, and then that code is distributed and run at each of these centers, and the models are aggregated and shared back to the various nodes and rerun again in an iterative manner so that it's updating from the data available at the various other institutions or centers or provinces, whatever those end nodes may be. But we don't have that, so, and I think there are very few, fair to say that there are very few systems that actually implement federated learning. There are some, but it's definitely not available or accessible for health research very easily. And so this is kind of where, this is the process that got us thinking, like, what are the barriers to doing that? And that work has led to additional two projects, one of which is that resulted in the CFAR, which is brief, which is where we started thinking about, what are the barriers? Is it a technical barrier? Is it a social barrier? Is it an ethics thing? Is it a legal thing? And it's a little bit of everything, right? And then just a lack of knowledge around what are the risks that are added by doing analysis. And people often conflate the risks of ML with the risk of FL, right? Federated learning. So I think, we tried really in that report to tease those out, like what is the added risk of doing something in a federated setting versus in a centralized setting. And the other aspect that we looked at in a research project is to see what are the technical barriers. So we obtained funding from the Cascadia Data Alliance, which is a consortium of sorts from the Pacific Northwest to do an analysis based on federated learning to look at diagnostic diagnostic modeling for ovarian cancer from digital pathology slides. And so we had centralized data that was coming from multiple institutions, but we ran it through a federated model, right? So with my collaborators at UBC, we've developed, in computer science, we've developed a prototype of a federated system that enables us to run data in a federated setting to see would those results be similar to what we would get had we centralized it, or would those results be very different? And you know, what are some of the barriers that we needed to overcome for that? And in that case, you know, we learned a lot, right? One of the things that we learned is that, you know, it's harder to do analysis when you don't see the data, when you're not interacting with the data, even though it would sort of lend itself to better, like more privacy protections and things like that. But because you don't see the data, you have to pre-process it in a way without seeing it in a similar way. You have to make sure that, you know, the data, the batch effects that we see in other data sets is also present in this case, you know, speaking to Rui's expertise around data set shifts, right? So you don't want to be detecting with your modeling where the data is coming from and having that drown the signal that's in the data that you're actually after. So those are all some of the technical difficulties that we find challenging with respect to federated learning. But I'm happy to talk more about any of these. Kind of stop here for now.
Yeah, thank you. And I think your two examples, you know, gave us a lot of insight to both the benefits, right? I think we're starting from a place where, you know, we understand that federated learning enables deeper privacy protection, deeper security, greater access to greater volumes of data. Those are the benefits, but these challenges are highly complex when you're talking about federated learning across multiple sites. Rui, do you want to share some of your examples about actually deploying federated learning approaches?
Yes. So the things I want to start with is just my overall experience working with different research networks here at United States. So my experience involving federated learning mostly are about electronic health records data. So I've been working on projects that's collaborating with a centralized network. So actually the identified data are put together. And also those more challenging cases that we really cannot see data in different institutions. So because my work mostly focusing on the methodology side, so we can leverage the centralized data just to demonstrate, you know, if you run it in a federated way, you get almost exact or, you know, not too different result as a centralized setting. That's what I have been done for the past few years for many of the method validation part.
Great.
In an ideal world, I would say federated learning can achieve, in most of the cases, the thing that you wanted to do with centralized data. We did, you know, supervised learning, unsupervised learning, different various type of tasks. But when it actually comes to the federated case, the challenges are from non-statistical side, so not like the methodology side. For example, I work with a group of psychiatrists. We have this network called PsycEmerge. The idea is precision psychiatry combining biobank data from multiple health institutions. Because of the funding situation, so I think those centralized network here at the United States, they are well funded. So either they are supported by the federal government or they have some other sort of funding source that can deal with the legal issues, the privacy issues, paperwork for everyone to share the de-identified data. So that's doable, but in a smaller scale, for example, a collaborator come to me and say, we wanted to do this. We only have data from these institutions and we don't want to share data in a centralized warehouse. And now is about like how we can do this without sharing data from multiple institutions. And my experience is extremely difficult if you're not having a well-established infrastructure, a group of people at each site that can understand what is required for every communication across sites. So a very concrete example we just recently have is we wanted to train this phenotyping model to identify who actually have bipolar disease. These are important for all the subsequent analysis, for example, risk prediction, everything, because EHR, there's no label available. So we have a gold standard chart review done at every site, but that's also very costly. So like we only have a small amount of label at each site. And the idea is to co-train the model such that the performance can be improved at a given site. And we eventually achieve that goal, but we have like weekly meetings with 3 groups sitting at 3 different institutions every week just to do troubleshooting. We actually share the script with all of the site to run the same exact content. The thing is, there could be issues that's not really about the statistical side, is more like the data processing. Something is wrong. There's no a particular code observed at a given site, this type of issues. And you need to do troubleshooting as a teamwork. And that thing, if you can't see the data, sometimes is really time consuming. Another sort of example we have is the situation where they get me on board on each of the institutions. So as a non-employee, so I myself can see data from every institution, but that's like behind the firewall of each server. So that makes things a little easier because I can play around with the data. And whatever summary stats I can download to my local device, and then I do the aggregation by myself as a single team. That is more streamlined because, I can control the data, I can see the data, I can do troubleshooting. So these are like 2 different type of federated learning I have done in the past few years, all involving like most likely these 2 situations. I haven't been seeing anything yet, like you have a platform that connects to each data set automatically. You can query, you can do the same cohort definition and then run everything automatically. That's not yet available for many of the research community I was involved in. But I also want to end with one additional experience. I work recently on the All of Us data, which is a multi-institutional biobank data here, also at the United States. That is fantastic. So I think whenever you can actually bring the data together, that's usually better. But I also see limitations. So they don't have they only have codified data. They don't have notes, clinical notes, and a lot of the more sensitive information cannot be put all together as a centralized way. But so I think there's pros and cons, but we can discuss
Yeah,
about.
let's get into that. So I want to remind the audience to feel free to put your questions into the chat box, and we'll get to them in the end of our session. But as they come to you, feel free to put them in there, and we'll try to address as many as we can. One observation that I'm noticing in hearing Aline's stories and Rui's stories now is, this approach, federated learning approach. We agree that there are benefits to doing it, and sometimes it's the only way that we're going to be able to do the kinds of analyses that we want to do on health data. But it's incredibly labor intensive, resource intensive, requires deep coordination and trusted collaboration with the partners. And so there are, those barriers themselves, or those necessities, actually, are going to add time, are going to add the cost to a federated learning approach. But hopefully in the end, it's worth it. Hopefully the outcome is worth it. And Rui, I appreciated your stories about comparing the centralized and the federated learning approaches, and seeing that the results were equivalent. John, over to you now to share some of your experiences and observations in applying federated learning.
Yeah, so I don't think I can share something directly about applying federated learning, but there's a couple of lessons that I've learned that I think are very relevant. There's this personalizer system that we created at Microsoft that essentially does reinforcement learning.
Great.
Eyes off. And so it's shared with, and the question is, how do you succeed at doing reinforcement learning eyes off? And I think that the integrity of the data was kind of a very primary part of the design of the system.
Mm-hmm.
So in particular, there's so I guess in a reinforcement learning setting, you have a case, you choose some action, you get some outcome, and you want to kind of value that outcome, right? And we set up everything so that if you wanted to even just describe a case to get a prediction, you'd have to be putting things into a format that was kind of readable by the machine learning algorithm. And it would be stored not on the customer system, but rather on in the cloud, so that you could have the integrity to know that later when you learn the outcome, you could just join them together. I need to get my fingers. Okay, you join them together, and then you can kind of automatically learn from that data in a systematic fashion. So the sort of eyes off
Right.
personalization or contextualization, maybe is a more general way to think about it, is something which can be done. But in order to do this, it's very hard to work with any kind of ad hoc data source. So if there's some sort of non-systematic capture, or even capture which is sort of varying across different pieces, it becomes tricky to incorporate the data. And so the kind of data like this place does data a little bit differently from that place type thing, that you sort of avoid that by design, to a large extent. So that works. And then I guess the other piece beyond this was what I mentioned earlier, which is if you want to do federation, there's sort of maybe two regimes to be thinking about. One regime is kind of federation across a dozen places, and the other one is federation across a million. And so these have very different structures. So in particular, if you're worried about personally identifiable information, if you have a million people, then there's these differentially private systems that actually guarantee that given the answer, the model that's learned, you just can't decode what an individual person did with any kind of high confidence, or even with a modestly low confidence.
Right.
So that works at kind of the million scale, and then at the dozen scale, which I think is where you have healthcare facilities which are trying to share information. You don't want to try to have differential privacy between the healthcare facilities because it would ruin the quality of the central model, essentially. Okay, so you should be thinking about those two different regimes, and then there's this final point that if you want to do differential privacy, then doing this centrally, so you get a central differentially private model, and then taking that centrally private model and then further personalizing it or customizing it or contextualizing it to each individual data source actually gives you better performance than just using the central model. And that can happen for many reasons. Maybe populations differ from one location to another. Maybe data recording, despite your best efforts, is not as the same in both places, and so forth. So I've seen a number of instances where I remember back when I was at Yahoo, we created a mass personalized spam filter using these kinds of techniques, and indeed specializing to individual people made a big difference in terms of the quality of the filter.
Right. What about the labor intensivity, though, of those two approaches, right? Like, it sounds like a lot more work to do the personalization approach.
So it can be, or it may not be. It's a question of how well you can. I mean, the personalized service, if you go to it, will just work. It does something. Now, it may not do the best possible thing. And so if you're if you're right on the very edge of what's possible in terms of sample complexity, and you're trying to find exactly the right model and these kinds of things, like you have 100 samples and it's like really tricky to even know that you have a good model, then I don't think it's going to work. But if you have something more common, where you have tens of thousands of events, which have a real signal, then at least you can get basic models in a completely hands-off way, as long as you can get the data into a standardized format. And so that capturing of the data into a standardized format,
Right.
I think you should regard as completely essential to succeeding in this kind of task in a non-labor intensive way.
Right, exactly. And I guess that's, that is one of the challenges when we're trying to federate across, let's say, different healthcare sites. They've all been collecting data in all kinds of different formats, using all kinds of different software and tools, and even jargon and nomenclature and language that's different for the same data or the same, effect. And it's just not standard. So Aline, what's your experience with that in the like the heterogeneity of the data across sites?
So yes, it's really interesting because I feel like even though we aren't really doing federated learning yet, because in the proper sense, right? In the sense that Google envisioned it, or that that tech companies are using it for health data right now, what we're doing is a poor man's version of federated learning, right? So we actually go manually do everything at each site. So for example, in my example, in my CanPath risk prediction model example, we had to apply for access at each province.
Right.
Some provinces flat out said, we're not giving you any data, we can't do this. Other provinces said, look, we don't have any infrastructure in place, you can't access anything very easily, it's really not worth your time to focus on this. We ended up focusing on 3 provinces, BC, Ontario, and Alberta. In BC and Ontario, there was already a secure research environment where we could log on and all that data would be available through there. Alberta didn't have that. And when we started the project, you actually physically had to go to the province to run the analysis. Like, you could not do this remotely at all. So that whole, the idea of federated learning being an automated system, right? Like we talked in various talked about the time it takes and how much effort it takes. That's not how it's supposed to be. Everything should be automated, right? You should just upload your query to a centralized system, or, that's one example of federated learning. There are others, but for the sake of illustration, you upload your query to one centralized node that then distributes that analysis. The data is interoperable. Your model runs smoothly, returns the results in aggregate, creates a global model, redistributes, and iteratively.
It sounds great, right? In principle.
It's amazing.
Yeah.
In reality, we do a version of that, right? So what we do is we log in, we request data, different data access requests. Each site has their own sort of privacy legislation that, oh, we can't give you this type of data, but we could give you this. And so you have to kind of find the lowest common denominator across the sites if you want to run an analysis that's global. And then once you have that, then you start basically working on pre-processing the data, setting it in a similar format across all sites. And as you mentioned, they're not interoperable. And thankfully, a lot of this, people are realizing that, yes, we need to use standardize or, like adopt some standards that we could then across the board so that we could have this interoperability. So we have, for example, ICD is great, right? Whenever that's used, it's amazing, but it's not consistently used. And what is available is different, and what they give you is different at each site. So we have to sort of manually curate this. And then once we have that, now you run your analysis and you run it again. But there are different systems, even the software that you use. So for example, we have to do some, imputation for missing data.
Yeah.
well, that software is not available here. Getting it installed takes 6 months. So you're going to have to come up with a different way of imputing. Just like basic things
On
that
and on and on, right? Yeah.
don't think about. There are barriers that you're facing because of this. And then once you have your final model, you pull it from the sites and then you aggregate it in a meta-analytic way, which is kind of the standard way of doing this, but you don't benefit from doing the iterative approach where you just then, take what you've learned from all the sites, globalize the model, and resend and retrain. I guess you could do this manually. It'd just be too labor intensive, right? So ideally, you want the infrastructure to be there so that this is happening automatically. And then the other thing that's really neat is that federated learning holds the promise of more privacy, right? Like, because
Right.
you don't have access to the individual records, that you'd be, information would be safe. Now, of course, this is not like a silver bullet. Yes, it's a safe proof. There are ways, like it's been demonstrated that with federated learning, there is privacy leaks and so on. And so there are methods like, differential privacy that John was talking about, right, to add on to that. But, with all of these methods that you create, I mean, differential privacy is one example of preserving privacy. There are others like homomorphic encryption and things like that that would sort of safeguard privacy as well. But, there's always this push-pull between privacy and utility, right? The more privacy you add, the more utility you lose. And so you need to really come up and our report, our CFAR report really highlights the importance of not overkilling, right? Like differential privacy could be overkill, especially in the Canadian setting when we're talking about administrative data, for example, because we're not giving this access publicly. You're already vetted, you're already signing all sorts of protection. You don't need this level of privacy added because we are all, like, the people who are accessing it are researchers, they're affiliated to institutions, we know who they are, we could trust them, right? And if we're operating within a secure research environment, there is this trust that's available to us. But we don't have, like, this is going to give us more privacy. Implementing a system like that in a Canadian setting will give us more privacy because we won't be seeing the individual records, right? We'll just be seeing it maybe at one institution where we develop the analysis, validate our code, and then you distribute the code. You don't actually see the data, but then that creates this problem, right? Like where now you're having to curate data without seeing it. And we had one student that I co-supervised, which was working on exactly that problem. Like, how do you do that, right? How do you blindly curate data? And that's kind of an interesting technical dilemma, I think. But with tabular data, when you've used standardized coding procedures to obtain that data, and you've harmonized it in a way behind the scenes, and all of the agreements are already established behind the scenes, right? And then that makes the access so much easier, and it would enable this level of automation. I think it's doable. It really is. Yeah.
And that's sort of was going to be my next question to the group is, is it worth it, right? So, in the Canadian context where we're trying, for instance, to to do analysis on data across jurisdictions where we have different privacy laws in different provinces, that's where the idea of federated learning has really sort of expressed its promise, right? Is like, this is how we can aggregate information and data across many, many, many more patients than we could do just within a single healthcare system. We faced a lot of barriers in trying to do it, but is it worth it to keep pursuing it? Aline, you tell us the story that it's been 4 years that you've been working to try to do a federated learning approach on the CAMPath data. Rui and John, do you see in our context, from the outside looking in, do you see that, we should continue to pursue federated learning in the Canadian context in order to enable AI within our healthcare systems?
I can talk first. So
Sure.
I think in many of the situations that I see with multi-institutional data, it does do better. Even with all these complexities of data sharing, data heterogeneity. So we have a lot of ways. For example, if the data are not distributed in the same way, we have a more robust method that you can do transfer learning. You can do a method that can prevent against negative transfer. So you don't do worse than just using a single data set. So from that end, I think is worth it in terms of promoting the whole area to get better result, to get more accurate models, either in a local scale or in a global, more generalizability, etc. So I think the true difficulty is still what are the barriers, and do we, have the ability to overcome, or can we come up with something that makes things a bit easier or more organized? So even I have spent tons of time sitting in the meetings, I still think if I see the result, it delivered as better AUC or PPV, I feel happy about it. So I think it's worth it. But that being said, I think as a statistician, I still don't understand who make the decisions of what can be shared and what cannot be shared. That's the part that's still puzzling me for a long time, because I see successful examples. Every institution contribute their data together, and as statisticians, as a methodologist, if you give me a clear rule of what's allowed and what's not allowed, I think we do math, we do a lot of things, and we come up with things that do the optimal type of analysis given the set of constraints that you set for us. But on the other hand, I still don't understand what is, for example, I think Aline, we talk about the problem of whether you can share a lower dimensional embedding of patient level across site. That can make a lot of method become much more easier. But at a lot of the settings I was involved, people have this different type of considerations, like what everything that's involved individual level, like index of I, that's not shareable across sites. But this is different in another situation. It's different in another clinical environment. So I think the time we should spend on is really moving forward, I think is more on policy level. What is really the part that you think is a bottom line, like for privacy, what do you want to protect and how much do you want to protect versus what can be shared? And then if the rule is clear, and I think a lot of people can work towards that to give us like a better strategy of how to integrate data and train models across site. And eventually, I think leveraging data overall, like even it's messy data, heterogeneous data, more data is better than
More
less.
data is better. More data is always better in machine learning. That's a really, really great analysis, Rui. Thank you. And, I think it's sort of motivating and inspiring for us to keep going and thinking about this. Go ahead, Aline. I see you want to jump in.
Yeah, I just wanted to jump in to say in our report, we talked a lot about proportionate response.
Yeah.
Right. So we don't want to really adopt this, I think this is there's a lot of perception about risk that's not real. And again, if you're sharing a lower level embedding, yes, technically you can re-identify people, but who is actually going to do that, right? Especially if you're in a setting where you could trust the various parties. Like a research setting or a hospital setting or something. Yes, you could, and there are ways to sort of beef up the security to the system, which would then, allow you to protect against, people that are hacking into it, like all the cyber attacks or any sort of third party that's coming in hacking into the system. So there are ways that are not related to privacy that we could protect the data. And I think it's really important that we don't shoot ourselves in the foot, right? Trying to build this bulletproof, fail-safe, future-protected, future-proofed, right? Future-protected against any type of attack. I think we may be sort of taking a greater risk by missing out on what we can learn and the advancement that we could have just by accessing that data. So it's really important.
Here on that point for sure. I mean, that's something that I'm really passionate about. The opportunity cost of not thinking about how do we deploy AI within our healthcare system in Canada is greater in a lot of ways than the risks of potential impacts on privacy, right? Especially when we hear from Canadians, we hear from patients that they want their data to be used for this purpose, right? So I think you're right. We all have to stay motivated and focused on the goal of enabling the deployment of machine learning approaches for better healthcare. John, what about you? What's your perspective? Is it worth it for us to keep going on this?
I guess I kind of decomposed the effort in my head into two
Yeah.
pieces. One piece is sort of the standardized data. And just thinking about standardized data a little bit, it seems like even if you weren't doing federated learning, you'd still kind of want to standardize your data,
Right.
because if there's something that
Exactly.
works well in one place,
Yeah.
it's probably going to work well in another place. And you'd like to make it as easy as possible to go and try it in the other place.
Right.
And so in terms of so there's a lot of effort maybe associated with standardizing data, but it seems like that's good effort that is
Good
worthwhile.
effort, exactly. That can lead to lots of good outcomes. Yeah.
And then in terms of federated learning, I guess the question is, what is the alternative, right? So the alternative is everybody just does their own thing with just one province's data, then clearly you're going to be in what the situation Rui is talking about, where more data is better. So if federated learning is a way to get beyond that paradigm, it's a complete win.
Yeah.
And then the other alternative you might consider is all the data in Canada gets centralized in one place. And that, of course, is apparently a situation where people don't have the trust to do it.
Yeah,
and so,
and it's historical. Unfortunately, we have our 13
so
provinces and territories that want to retain their autonomy. Yeah.
yeah, I completely understand. I mean,
Yeah.
there's lots of trust issues that people have, and they can
Right.
be very reasonable trust issues.
Sure. Yeah.
And so I think we should sort of accept where people are as far as trust, and then act based on that.
Amazing. So back to the Q&A, or to the Q&A now, which is where I wanted to get to. Thank you for prompting us, Alex. One of the questions that's come up in the chat is for everyone. And let me find it again. Pardon me for a second. It's from Lindsay. And I think, Aline, it's probably you might be well positioned to answer this one. What resources are available to help navigate the different government and provincial regulations when setting up FL? She says the difficulty that they face is that they just get, like you said, a blanket no, right? Like, no, you can't access our data, despite the fact that our collaborators would not be able to view it, or there wouldn't be the same kind of visibility. So can you recommend, Aline, how a researcher in Canada might start their approach to federated learning?
I'd say it largely depends on what type of data they're trying to access, right? So in my example, I was working with CampPath data and I wanted to access administrative data. So the Health Data Research Network Canada has another sort of branch that's called DASH, and they're the ones, and I was really I really can't thank them enough, because had it not been for them, I would have had to approach each individual province separately, but they kind of coordinated that. So we would have like Zoom calls and we would discuss in a Zoom call. So what I want to do this, what can I access? And everybody would be on the call and would say, in Alberta, you could do this, this, that. In BC, we have this, right? And so that was kind of a coordinated effort with all of the provinces. And that was really amazing. So I definitely, I'm not sure where the mandate of DASH ends. And I think there's going to be a session where we're actually specifically going to talk about that coming up soon. So stay tuned. But I think that was very, very helpful for us. Now, if let's say you are working with a specific group that have specific research data, so maybe it's a network of researchers that have collected research data, so it's not linked to administrative data sets or anything like that, then it's going to be basically negotiating data sharing agreements, applying for ethics, and trying to convince the various ethics boards, like, this is it. There's no other way, right? Like, you have to do, and I am trying to set up, so I'm currently setting up two federated data networks, and those data networks are going to be doing a combination of centralized whenever we can and federated when we cannot. So it's going to be like a kind of a bit of a mixture, like a hybrid model. And it's going to be for gynecologic cancer, but this is like exactly it. So let's say you have 100 centers that are participating. It's 100 data sharing agreements,
Right.
100 ethics application. You have to do it. So
Yeah.
the idea is, the idea is you do it once, and it's forever there, right? It's a lot of upfront work, but then you get you reap the rewards.
Great.
Yeah.
Thank you for sharing that. And I wanted to add that Mahmoud from ICES shared their experience at HDRN implementing a license agreement approach for sharing trained models across participating sites. So that's another sort of administrative approach to starting to explore federated analysis models. Let's see if there are other questions coming in. Here's one. This one came in from Michael earlier on in our conversation. He asked if any of us are familiar with DSEN, the Drug Safety and Evaluation Network. It recently moved over to Cardiff. They've been doing, he says, at least parallel, if not federated analysis in 7 Canadian provinces for over a decade. So parallel analysis, if not federated. DSEN, Drug Safety and Evaluation Network. Anybody familiar with that? That's not ringing any bells for me. I know Cardiff, but I don't know DSEN. Okay, that's not one's not ringing a bell for us, Michael, but now that you've raised it, we will be looking it up for sure. Just going back to some of the earlier questions, this one's from Mahmoud as well. Can you speak about the potential biases that could be introduced by inconsistent annotation and labeling? So in a federated model, what problems and challenges arise because of inconsistent annotation and model and labeling?
So one thing that I would just sort of quickly say, errors occur in annotation and labeling and all of that. So they occur all the time, right? But when you're able to see the data, you could spot them. So could you imagine like one site where they convert a label? So instead of dead, there are like one encodes dead and 0 alive, and maybe that's flipped at that one site, for example. Now you have like completely the reverse, and you won't know it, right? That's the key thing. It's going to be very difficult to know it unless you start doing, that's why it's very important to be able to do descriptive statistics at the local, in a federated way. You have to be able to do a lot of like sensitivity analyses and things like that, just to sort of be able to identify these things. And again, this is going to be, once a system like that is on and operational, again, so far, everything that's been done in the federated learning literature has been based on simulated data, synthetic data, experiments that are super well curated data sets. Once you start working with real data that's completely disorganized and that requires a lot of like cleaning and pre-processing, it's going to open up the field in a big way for methods to do all of this in a federated way.
Great. John, I see you responded to that question in the chat when it came up. Do you want to share your perspective on those issues?
Yeah, so I think errors can be in almost anything, and so it could very well be that you get essentially arbitrary outcomes when there are errors in how data is recorded, particularly systematically. One anecdote is when we were doing that mass personalized spam filter a long time ago, there were actually spammers who were flagging non-spam as spam and vice versa in the data set. And personalizing allowed the central model to actually become stronger. So you could actually do the full bit flip, the lived dead bit that you mentioned, Aline mentioned earlier, and the system would kind of learn automatically all of the signal for the spammers who were trying to pretend to do weird things would just get absorbed by that personalized filter. And so that ended up helping substantially with the quality of the overall system.
That's so interesting. It's like how do you subvert those kinds of adversarial attacks, right?
Yeah.
Like,
and so subverting through contextualization and personalization, I think, can actually be quite effective at times.
very interesting. I would not have suspected that. That is very interesting. We just have a couple of minutes left. Let's see if any other questions have come in while we've been talking. Shay asked a little bit earlier, is there a central site or a group of people we can access to understand and see all the efforts so far in this space within Canada? Aline, you talked about you're setting up a couple of new federated learning sort of groups and approaches around gynecological cancers. Are you aware of any sort of central spaces, teams, organizations? I'm not, that sort of bring together all of the activities in this space in Canada.
I don't think so. I think a lot of people, there are a lot of efforts. I think currently they're a bit disjointed, and I think it would be great to create that, maybe hold that space, at least virtually, where we could all kind of share our experiences and build on each other's work. I know the Marathon of Hope, for example, with TFRI, they're hoping to do something like that. And there are other initiatives for sure, not just in the public sector and the research setting, but also in the private sector. So I think there's definitely room for something like that. I think it's a great idea.
Yeah, absolutely. And we can, of course, bring in our colleagues from the US, like John and Rui, who have been working on this space and, again, learn from their experiences and their perspectives as well. So it seems like there's interest, at least, in, creating a space for people to get together and share their work and explore opportunities for collaborations as well. So I'll take note of that, and maybe you and I, Aline, can follow up even with HDRN and see what might be possible. So with that, we're going to wrap up our session. I'll pass it over to Alexandra, but I'll ask all of our audience members to join me in thanking the panelists for a great conversation and for being so descriptive and open in sharing your expertise and your experiences in this very challenging, but I think, as we have discovered, very important approach to deploying AI within our healthcare system. So thank you to all of our panelists.